endoscopy is a test to look inside the gastrointestinal tract. So potentially anybody who has symptoms of a problem inside the stomach or the large bowel or the small bowel may need an endoscopy. It is the best test used for diagnosing a number of different symptoms. These can range from difficulty in swallowing, pain, particularly in the chest or the stomach, problems with bleeding, so anemia or actually vomiting or passing blood, weight loss, or a change in bowel habits such as diarrhea. Any of these may require an investigation either of the upper GI tract, which would be an endoscopy or gastroscopy, or the lower GI tract, which would normally be a colonoscopy or a flexible sigmoidoscopy. As well as for diagnosing people with symptoms, endoscopy can also be used to provide treatments. So we may want to take biopsies to make a diagnosis of a particular disease, or we can remove polyps or other problems within the GI tract. This is often done after the first endoscopy, but may also be done in the initial procedure. An endoscopy can be carried out by anybody who has been properly trained to perform these procedures. Usually, in most cases, this will be a doctor, and they will be trained either as a gastroenterologist or a gastroenterological surgeon. Sometimes these are done by nurses, particularly in the National Health Service. Most people who do these procedures will have been accredited with the Joint Advisory Group for Endoscopy, which is an overarching body which credentials people to perform gastrointestinal endoscopy. Some people may also be accredited for bowel cancer screening, which requires an additional test and checking of their expertise. There will be some preparation for any endoscopy. It depends whether the endoscopy is going to be into the stomach or around the large bowel through the bottom. There may be a requirement to stop some medicines, particularly things like anticoagulation, some days beforehand. There will be a period of fasting, particularly for a gastroscopy, which is important because the stomach needs to be empty of food to allow the endoscopist to see things properly. In addition, for small bowel or colonic procedures, such as a colonoscopy or a sigmoidoscopy, there is the need to take a laxative. This is to clear the bowel of any debris and stool to, again, make sure that the endoscopist can see things properly. Most people consider that that is actually the most difficult part of the test, and the endoscopy itself may be easier than the bowel preparation. It is entirely up to you whether you would like to have sedation or not. A lot of procedures are done without sedation, perhaps with a local anaesthetic spray for gastroscopy, or something to relax the bowel for a colonoscopy. If you are feeling anxious or worried, then it may be better to have some sedation. We use what is called conscious sedation, so you're not completely asleep like with the general anaesthetic, but you are less aware of what is going on and a bit more relaxed for the procedure. This can often make it much easier. If you are having sedation, it's important that you know that you will need someone to take you home after the procedure, because sedation can affect you for up to 12 hours afterwards. You shouldn't drive or operate heavy machinery or sign any important documents after that. The choice of whether you want to have sedation or not is something you should talk to your endoscopist about. Some people who have these repeatedly find that it is comfortable to do it without any sedation, but the majority of people, particularly in their first time, want something to just make it a little bit easier for them. Like with any tests or invasive procedure, there are some small risks with an endoscopy. First of all, there are small risks with any sedation that you can have. These can involve problems with your heart rate or problems with your breathing, but these are very rare and usually managed very easily within the department. There are risks of putting the tube either into the stomach or around the bowel. The main risks of causing any bleeding or damage to the bowel. Both of these are very rare, and the endoscopist will take great care to avoid any problems. If there is bleeding, it is usually a small amount and either easily controlled at the time of endoscopy or does not require any further treatment. But you will be told that in the very, very small chance that there is a significant bleed, it may result in you requiring a blood transfusion. Damage to the bowel or stomach is also extremely rare, but it can happen. And so therefore, when the endoscopist is consenting you for the procedure, he will mention that it is possible. Again, like with bleeding, usually this is recognised at the time of the procedure and can be dealt with during the procedure. Very rarely, it may be necessary to do further interventions after the procedure, and in extremely rare cases, a surgical operation may be needed to fix the problem. However, this is incredibly rare, and for the vast majority of cases, even when complications do occur, these are managed very safely and completely result in a normal outcome for the patient.